of the sector exacerbate a person's disability status, which not only affects the person with disability but also the entire family. Additionally, it is identified that there is a high proportion of caregivers who must remain at home with the person who has a disability and are not able to work or have a consistent job. The person with disability is confined to the home due to poor job opportunities, limited supply of institutional programs, lack of resources to access private care, and limited access to assistive technology. The physical and social environment, including violence and illicit activities, results in limits in participation and social interaction.
And so in relation to this context, we identified two primary issues that we focused on for our project. The first issue is the problem of limited information access. There's an information disconnect. There's information about health and rehabilitation and resources, assistive technologies that exist, but no reliable means to communicate the information to the population in El Codito. As you see, 19% of the population in Colombia have computers, even less, at 10% have internet access. The second issue that we focused on is the problem of social isolation. As Francini identified in the context, the environment is very aggressive. It's on a hillside. People with disabilities and caregivers are physically and geographically isolated. They're disconnected from the community and have limited opportunities for social interaction. These two factors combined have been found in the literature to contribute to poor health outcomes in populations. Now, the project we developed, we titled El Enlace, which is Spanish for the link. The purpose of the project is to develop a feasible method for improving information access and reducing social isolation of people with disabilities and their caregivers in El Codito. The research question we're focusing on for this presentation here is, what is the experience of participants participating in this project? Now, when it came to deciding what technology to use, we've already identified that there's no computers and limited internet access, but almost 100% of the population has access to a basic mobile phone. We found this to be true in the community of El Codito, with either every household either had a mobile phone in the home or they had a neighbor that had a mobile phone that we were able to utilize for the project. We used the SMS, which is basic text messaging, as the method for information access and social interaction. SMS is reliable, it's low cost, offers real-time communication method for a community-based project. For SMS delivery, we used a program called Frontline SMS. I'm not sure if you're familiar with it, but it is a free and open source software. It's used predominantly in international development. It's a scalable and customizable software. The only requirements, as you see in the picture, is one computer and one basic mobile phone connected to it. Together, this becomes an SMS delivery hub. Now, for the project, we had two groups of people. We had the population of participants, which comprised of 8 caregivers of people who have disabilities. 7 were mothers, 1 was a father, a wide age range of 27 to 58, and we also had 1 adult person with disability participate in the project. We also had a community coordination team of information and resource coordinator, which is Francini, who was responsible for researching contextually relevant information and sharing the information with participants. We had the Universidad de Rosario project coordinators who helped handle the logistics of the project. And we had a community coordinator who was critical to the project. The community coordinator is a local community leader from El Codito. She acted as the link between the academic institutions and the community of people with disabilities and brought them together, helped us to establish trust with the community. She was critical to the implementation of the project. And then technical coordinator, I helped with that from the University of Alberta. I monitored the technology remotely and helped with some training activities. As you can see in our timeline, in August 2013, we did training, collected baseline data, then we had a 3-month implementation, and then following that, we did data collection and analysis. Now, these are the functions of the system that we developed. You can see here that we have the coordination team on the right side. They would send information to the SMS hub. The SMS hub would then send all of the health information to caregivers. As an example, info. This is the one that's in Spanish. So this says that there are vaccinations available to children under the age of 9 at the local hospital. And here the second functionality is health questions. Here the caregiver can use the health question keyword, send it to the SMS hub. The SMS hub would then send the health question to the coordination team, and they can respond as appropriate. The third functionality in the system was social interaction. Here we have a caregiver who uses the social interaction keyword to the SMS hub. The SMS hub then sends the interaction message to all the caregivers in the project. And here's an example of that. It's in Spanish. Olga here asks for what is a remedy for a sore throat, and Lucia, who's another community member, responded saying gargle, take hot water, add lemon and salt and butter and a bunch of other local things. It's a home remedy, and take it 3 times a day, and if a fever develops, make sure you see medical attention. So that's an example used in the project. The quantitative results, we had 56 information messages sent during the project that averaged out to over 3 messages per week during the 3-month intervention. We had 23 instances of health questions. Sometimes this was a question about disability, about health status, about health service delivery, but also sometimes they would ask a question to us just to express gratitude for the project. There were also 30 instances of social interaction between caregivers. This was greetings, encouragement, that sometimes it was caregivers praying for one another. The qualitative results is where we focus predominantly. Our primary data collection method was focus group. We found that using a focus group really helped gather that collective experience and that shared generation of knowledge that was important to us. For a data analysis, we used a basic content analysis. It was quite interesting because Francini and I conducted the content analysis in parallel. She did the content analysis in Spanish, and I did the content analysis in English, and we validated at various points, stages in the content analysis to make sure that we were accurate in the analysis, and then we validated the completed analysis with participants. The primary overarching theme of the project is that we found that it opened a window to possibility, that disability experience is lonely, but the project brought the possibility of a social network, that disability experience is socially isolating, but the project brought community participation. But disability is stagnant and life is cut short, it's truncated, but it opened a window to the possibility that things could change. The first of these possibilities, the possibility of a social network. The life is full of challenges, but the project brought strength. They're no longer alone in the disability experience. There's an interesting transformation of I being an isolated, solitary individual to a collective we. The second possibility is the possibility of community participation, that in fact the project led to attendance of community events. In some instances, it's the only event that these community members participated during the full year. You see the quote at the end, "No word of a lie, this year I've only been to this lunch and one other community activity organized by the mayor, and I found about that through the text messages." And the last possibility was the possibility that things could change, the possibility that this social isolation could be reduced and there could be increased self-worth and self-esteem. There could be new meaning to daily activities, and that there was a change in the perception of disability. The quote at the bottom is, "I was able to learn that disability is not a disease that isolates you." Just some final project reflections. Ignore the first line, but the second line is that we did believe that SMS was an effective tool for this type of project, but there were some sustainability concerns. SMS is low cost, but it still has a cost, and so there needs to be a way to be able to pay for long-term implementation of messages. There's also the administration cost that we didn't necessarily foresee, that it took a lot of time for the community coordinator and for other administrators to run the project. Francini will just talk about a spin-off project that resulted from LMASE.
Next steps. As of the project in this last year, it is important to note that the University of Rosario has developed a new initiative in order to develop a social support network and improve community participation and awareness of disability issues. Many people with disabilities and caregivers from the community were invited to participate in this project, but only people who were involved in the El Enlace project and other research projects conducted by the University of Rosario have become active participants in the project. This may suggest that previous active participation in a community project leads to changes, perceptions, and opens the window to ongoing community participation. Thank you.
So that's it in a nutshell.
Thank you. Oh, can I use my prerogative to ask a quick question, even though we're holding questions? Did any of your participants have limited dexterity that interfered with their ability to use the SMS?
For this initial pilot, we wanted to use participants who are familiar with using SMS messaging, and so we only included participants who had experience, and so no, we didn't include anyone with dexterity issues.
That makes perfect sense. Thank you.